huge shift in healthcare, because access to healthcare has now become a lot easier with digitalization and a whole number of virtual consultations. And one of the fields in which digital healthcare can actually be easily applied would be diabetology, because this is one field where you can easily approach your doctor over the online platform and get treated effectively. Number one, unlike many other fields where you require a surgery or you need that one-on-one consultation where we need to examine the patient. Of course, in diabetes itself, there are complications. That, of course, is a different ball game altogether. I'm not going to discuss that here. But simple, effective management of diabetes can be done through the digital platform, and that is the shift that we're actually seeing. Of course, this is not just because of the COVID pandemic, or not just the pandemic or the lockdown that has pushed this shift, but it has probably been taking place even much before that, but the transition has been a lot more rapid, or sort of pushed a little faster during the lockdown and the pandemic. But the other most important aspect is that type 2 diabetes, or diabetes itself, whether type 1 or type 2, is a chronic healthcare model. So you require frequent visits. With diabetes requires frequent monitoring, frequent visits to their doctor, and they require frequent tweaking or adjusting of their medication as well. And this need not require the patient to go to their doctor each and every time. So when I say frequent, it could even be as often as once a month or once in 3 months. And the whole concept of a patient needing to go, wait about a couple of hours, given a blood sample, sit outside the doctor's chamber and be waiting for hours, and skipping work, missing mothers who leave their children at home. There's so many aspects to it, So all that is actually moving ahead and shifting more to the digital platform, where at the click of a button, you get your test done at home at the convenience of your timing, and you get your results on your online portal, and you can consult your doctor through a virtual consultation, and your blood glucose can be kept under check more effectively, because you can more frequently approach your healthcare professional and you get more frequent advice. So of course, it's not just the doctor, it's also your healthcare provider, like your education consultant and your dietitian. You can get diet advice, you can approach a nurse for whatever doubts you might have. So there's so many aspects to digitalization and to healthcare on the digital platform. We needn't think of this as a disease. It's more of a disorder. And that's the way that we always describe it. And anyone with diabetes deserves to live a healthy, normal life, just as a person without diabetes. It just requires a little bit more of discipline, or just small changes in your lifestyle, and taking your medication regularly, frequently visiting your doctor, either on the virtual platform as we had discussed, and you can, like I mentioned, live a healthy, normal life with diabetes. There's really nothing that you can't do. And so quite often when I see a patient in the clinic, it's a spouse or a husband or a wife, I often encourage them to bring in their spouse. I encourage the men to bring in their wife, or the wife, so that, it makes a huge difference, because diabetes is a lifelong disorder. It's something that a person has to live with 365 days of the year for the rest of their life, because there is no cure for it, but it can be treated effectively and reduce the risk of complications. So I think a family support here is extremely important for whoever the family member might be, because there's little changes which have to be made that go a long way for better outcome. And these changes require to be made on a sort of your daily activities, on your daily life, including your diet, your physical activity, you're taking your medication twice a day, or those who are on insulin. Sometimes patients do go in for a low sugar or hypoglycemia. And so it requires a lot of awareness, a lot of support from your support system, whoever that might be, your wife or your husband or your family or whoever it might be. And this even applies to children who go to school. Of course, schools are all shut now, but when children used to go to school, we used to tell parents that, please inform the school teachers or the principal, and let the schools also be informed about the child's condition, because in case of an emergency, if the child goes in for a hypoglycemia, or the child is playing a sport and suddenly develops a complication, the teacher has to be aware of the child's health condition and what to do at that moment. So the support system is extremely, extremely important. And diabetes, as I mentioned, is a lifestyle disorder at the end of the day. So you do require your family support at every level. So diabetes in children is, a different type altogether. Most commonly, we encounter what is called type 1 diabetes. And this is a type of diabetes where children are dependent on insulin. So earlier it was in fact referred to as insulin dependent diabetes, because this is a condition where the child sort of stops secreting, or the pancreas stops secreting insulin, and as a result they require insulin to be taken from outside. This type of diabetes is completely different from type 2 because it is not purely a lifestyle disorder, unlike type 2. This is what we call an autoimmune disorder, where the body itself recognizes its own body tissue, so the pancreas here in this particular case, and fights it and sort of destroys the cells, which are called the beta cells, which secrete insulin. So this is a condition which is called autoimmune, and this is what causes destruction of the pancreas, and eventually the child loses the capacity to release insulin, which is when they require insulin from outside. This is quite challenging, or it's in fact very, very difficult for parents to accept it. So there are different stages when when you look at the psychology behind it, for the parents, for the children. There's many aspects to it, because the social sort of stigma that's attached to it, and day-to-day activities which, but on the brighter note, on the brighter side, what we have to realize is that there are people who have been living with type 1 diabetes for years together, and almost detected when they were like young as around 1.5 or 2 years old, and who have lived a normal, healthy life without complications and without any compromise on their daily sort of activities, and who have been able to do what they want and be successful in their life. It is important for us to sort of provide support, both, of course, treating the disease is one part of it, providing support, emotional support for the parents, counseling the parents, and making them more equipped to handle this is extremely important. And of course, counseling the child goes without saying.